Okay.
Thank you, Dr. Nisha. Uh, Good evening, good afternoon, and good morning. This is the 1607th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SAURAV Arora. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself. And those who miss the session can watch it, and you can subscribe it without paying any money at IFPH Homeopathy at YouTube. So let me come to today's guest. As you all know, our guest is Dr. SAURAV Arora, and he is a gold medalist in MD Homeopathy, is a faculty at the London College of Homeopathy, United Kingdom, and is a member Regulation Society of Homeopathy, United Kingdom. Is a guest faculty at Dr. B.R. Homeopathic Medical College Hospital and Research, Baxter Homeopathic Medical College. Is a founder of the initiative to promote research in homeopathy and vivid homeopathy. Is an ex-senior research fellow from CCRH, uh, NMAS, and SHMC from 2008 to 2014. He is an ex-physician also, and author of 47 articles, including 20 peer-reviewed journals and 27 general articles on homeopathy. He has more than 17 years of experience and has presented beautiful papers on research in this forum earlier. And today, Doctor will be discussing about 4 pillars of homeopathy practice. As all of us know that homeopathy is standing just on a table like that. And as you all know, what are the signs of homeopathy? All those things will be discussed. I hope all those things are about to discuss by Dr. SAURAV Arora. We welcome you to this session. Welcome, Doctor.
Thank you, sir. Thank you so much for this warm welcome. And I'm happy to be again here to share my thoughts, to learn something. So thank you so much for having me on this platform. So without further delay, let us start. Am I audible to all?
Yes, everything fine, sir.
Let me share my screen also. And I hope my screen is visible to all.
Yes, visible. Everything fine.
Yeah, perfect. So today we are going to discuss the 4 pillars of homeopathic practice. Now, it is not the pillar we use or we read in our standard textbook of organ of medicines. These are the 4 pillars of homeopathic practice. Now, there's a difference between philosophy and practice. If we have a sync between the philosophy and the practice, we are a successful practitioner. Now what happens, we have certain things in our mind as philosophical learnings, but when it comes to practice we do not apply the same to our practice. Now this happens many times at many places. We see that there is some no, they're not synced, they have the sync issue. That is why we have different schools in homeopathy, or different thoughts in homeopathy, or different style of practices. Some people are using single dose, multiple doses, polypharmacy, monopharmacy, patent practice. Now, all these things, they work. Let me tell you very honestly, they work. And being a clinician, we are, habitual of using such thing in our practice. So today we are going to discuss what are the 4 pillars of practice. Now, first, we all know homeopathy is a complex science. Why complex science? It is prepared by the simplest method, that is potentization. But the story behind potentization is too complex. Nanobubble theory, entropy, physical chemical properties, you name, and we have n number of theories just to prove the existence of homeopathy. So it's not an easy science. It's a complex science from the physical chemical point of view, from biological point of view, and from understanding point of view, and especially from clinical point of view. People spend their lifespan understanding the homeopathy, and still we have many things to learn, many areas to explore, many things to see. So it's a complex science. Now, this is a complex science, but yes, it's an in-depth art. How we give homeopathy, how we use homeopathy, how we imbibe the knowledge of homeopathy in our daily routine practice, that is an art. That is the area we are taught in our education system in couple of years, 4 years, 5.5 years, 3 years, depending on the courses and the country. That yes, apply that complexity with an art. This will differentiate you. This will be your unique selling point, USP. This would be something which will differentiate your style of prescription from the others. This will make you legend. So that in-depth art we need to understand in detail if we are aiming for a good practice in homeopathy. So it's a complex science, and it has an in-depth art. That artistic style nobody can teach us. We can learn from many masters, we can read legends, we can go here and there, but the art, until unless you apply that art, it is not going to solve the purpose. So it's a complex science and an art, in-depth art. It needs dedication. Gone were the days, okay, fine, I've read homeopathy, I've done the course, I'm a successful practitioner. No, we need to be dedicated. We need to be dedicated with each and every patient. That dedication requires surrendering. That dedication requires patience. Because see, complexity, art, and dedication. This is the reason why people leave homeopathy in between within first few years. Because until unless they are dedicated to this profession as a profession, they're not going to have that success, or they're not able to achieve that milestone they are entitled for. So it's a complex science, it's an art, it needs dedication, it needs perseverance. The constant urge to learn, to upgrade, to maintain our standard of practice, perseverance, we need to have if we want to practice homeopathy. So it's not an easy science. It's a science which needs that dedication, that perseverance, that art, that complexity. Now, this is just a few words about homeopathy. Now, what are the pillars? It's a common English language. What are the pillars? The base with which is important. If we want to have a certain concrete, we need to have strong pillars. So today we are going to discuss the 4 pillars of homeopathic practice. Now pillars, but we are actually targeting ourselves to the 4 pillars of homeopathic practice, the 4 pillars. So without taking much time, let's first pillar is baseline knowledge. From where I got my homeopathic education, learned what was my exposure in homeopathy, who taught me what, because those 3, 4, 5 years, the initial 5 years is the strongest foundation. And if that foundation is not strong, I'm sorry, we cannot practice the classical or the ethical homeopathy. We would be homeopath for life. We would be experimenting here and there. We would be giving medicines. But until unless that foundation, that baseline knowledge is strong, we are not we should not expect quick success. So that baseline knowledge is the first pillar. Now, this baseline knowledge we acquire, we see, we observe, we read, we perceive. It is not like having textbooks. Okay, my cupboard is full of homeopathic textbooks, and I've not read that. Even I've read that. I have read only just to pass the exams. No, every day if I go to college or attend classes, I am seeing something, I'm acquiring something, I'm observing something. Now, this is what we were taught in our BHMS time, in our graduation time, that there is a difference between observation and perception. You know, an intern or a student may be observing 10 symptoms in a patient, but what was the perception of that symptom? What was the language that we are going to use to convert that into a repertory or a materia medica, or converting the patient's language into materia medica language? Was that perception homeopathic perception? You may be having 50 symptoms in your case, but do we prescribe on those 50 symptoms? No. We prescribe on two symptoms, we prescribe on one symptom, because we have perceived that aura of gelsemium in a patient. So I'll be taking examples in between, so that just to keep the momentum and just to keep the interest intact. So gelsemium, I have observed the whole patient. Now my mind said, no, as per my knowledge of materia medica, this patient does not require acid phos. This patient requires gelsemium. So I use the PDF, potential differential field. I use the anamnesis. I use the baseline knowledge. I use that perception or that power of observation, going into the depth. Okay, fine. This is different. Okay, this patient's headache is different. Okay, this does not require belladonna. It is netramure. It is iris versicolor. It is ignitia. This is how you differentiate remedies. Now, until unless I have not acquired that knowledge, not observed that knowledge, not read that knowledge, I cannot, go and have the comparative materia medica. So this is the strongest foundation. The first pillar is the baseline knowledge. So right now, we are in a society or a system where institutionally qualified practitioners, okay, are there. But let me tell you, even there are no institutionally qualified practitioner. They acquired so much knowledge. They read so many books that we cannot even think of. They are very well versed with the materia medica, the philosophy, the organon, and they started practicing. They started disseminating or promoting homeopathy. So that baseline knowledge was very strong. Now, these are the sources for the baseline knowledge. Books, yes, we have done a course. We have done BHMS, we have done MD, we have done PhD, we have done, now the super specialization courses are on, they're suggesting super specialization courses. So the books are there. And now, books and literature are two different things. Oh, fine, we have standard textbook, but there are certain other literatures also. We have some articles, we have some magazines, we have some notes of our seniors, we have, short notes or clinical tips or quick tips. All these things are sources for that baseline knowledge. I still remember our materia medica teacher, Dr. Mukesh, used to tell us few clinical tips in between, and they're very hard to find, very rare to find. The same I do when I go to college, or even take the organon class. I try to give them some tips which are in the materia medica but verified clinically, so that literature, that article, that magazines, read in between the lines, that is a good source for that baseline knowledge. Next, what we learn from that baseline knowledge? Okay, I have read books, I have read articles, I've read magazines, I have read literature, I have read this, that. I have read all of my cupboards book, but what did I learn from that? I learned aphorism 3, knowledge of disease. Few days back, when one of my students said, sir, we have heard that there is no need of naming a disease in homeopathy. Why not? If a patient is visiting you and ask for the medical, should you write the 40 symptom that the patient presented to me with all these symptoms, and he's advised rest on what? I need to have the name of the disease. I need to respect that disease part from the medical legal point of view. I know there are certain remedies in homeopathy which are organopathic. Believe it or not, accept it or not, they are there. Our materia medica is full of such remedies. So we are using the constitutional remedies, we are using the organopathic remedies, we are using the specific remedies. I'll come to the specific part later, because that specific is, we use specific according to an individual, not because of disease, but there are medicines. If you search Boric materia medica or Fatigue materia medica, there are remedies which are given on the basis of the name of the disease. Why? In certain conditions, yes, in certain terminal conditions, in chronic conditions. So that knowledge of disease from the homeopathic point of view, disease, and from nosological point of view, disease, I should be very well. If I have the knowledge, I have the baseline knowledge, diabetes patient, yes, but my diabetes patient is responding well to the lycopodium. The other diabetic patient is responding well to the acid phos. The third patient is responding well to the syphilin indica. The fourth patient, old age patient, there is no, all changes are there. I need to give Syzygium. There is no other option. So that baseline knowledge is teaching me the knowledge of disease. Next come the knowledge of medicinal power. We don't ask,
we don't ask a patient or we don't ask like our students, or our student don't ask, sir, how many drugs we need to keep in our homeopathic pharmacy or at our clinic. We always say, how many medicines do you have in your clinic? So there's a difference between drug, medicine, and remedy. So whatever we are using, we are converting that medicine into a remedy according to the patient. We need to be very clear. Okay, fine, I have 350 medicines in my rack kept very beautifully, but am I going to use all these 350 medicines in the patient? No. For my patient, maybe a one remedy, or maybe a biochemic, or maybe an add-on therapy, or maybe an adjuvant therapy, or maybe a comparative trial. Because we see patient from every strata, from every disease we see patient. It is not always that we always see the cough and cold patient. We'll see the cancer patients also. We see the patient where the terminal illness is there, and simply um, improving the longevity of the patient is the prime most focus. It is our aim, as per version 1, aim of the physician, the mission of the physician. At that, our mission is only to give relief. So I need to have very that knowledge. Okay, fine, whether this medicine would be the right remedy for the patient. Now this is the problem. A student comes, okay sir, I have this problem, and I went to three different teachers in our own college, and three different teacher prescribed three different remedies. I am the same patient. I narrated my same complaint to Dr. X, Dr. Y, Dr. Z. But sir, prescribe me this, ma'am, prescribe me this, and you are prescribing me this. So that perception is only when our baseline knowledge is very strong. We'll come to this part later when we connect the dots. So this is one dot. Choice of remedy. Yes, it is connected. How to convert that medicine into choice, the perfect choice. This is where the actual artistic thing is. We always look upon the legendary homeopaths that they will prescribe some magical remedy. Sometimes they prescribe only a simple remedy. Even an intern, repertoire okay, sir, that legendary homeopath prescribed Natromure to me, and my repertorization also says that it is Natromure. So what is the difference? The difference was maybe a potency, maybe the repetition, maybe how and when to give. This only comes with experience and knowledge, obviously. Then the proper dose and the hint about application. Choosing a remedy is winning half the war, but till how long you will continue that remedy? Patient is following you for like a chronic ailment. So should I get for a month, or 2 months, or 3 months, or 6 months, or 1 year? So the catch point here is the line of treatment. And this line of treatment, those who have understood this concept, the line of treatment, they are successful in their practice. Because finding a remedy, anyone will find a X or Y remedy. Something will work. The aconite will work, or belladonna will work, or chamomilla will work. something will work. But what after first prescription? What after second prescription? How to follow? Till when to follow the patient? Patient is taking the treatment for arthritis from you. So till when I should be giving that medicine to the patient? When to give the nosode? When to give the other things? So this hint about application is what I will summarize here as the line of treatment. The more we are perfect in the line of treatment, and you will see the patient comes to you, okay, sir, your line of treatment, what you have, the way you choose the remedy or follow a patient and when to stop, when not to stop. Okay, fine. Okay, now you don't need any remedy. Take this nosode or take this antisoric. Just go. Just wait and watch. The next thing comes the experimentation. Now, this first pillar is baseline knowledge. We are very strong in that. We have read books, we have read literature, we have read everything, we have listened to all our teachers. Now comes the experimentation. Now, this is a very crucial part of homeopathy because we always experiment. We are called the clinician, we are called the practitioner. We always practice. There was a joke, sir. Doctors are one such breed. They never attain any success because they always practice. They don't attain perfection. Now this perfection is a secondary. It's a relative phenomena, but as a joke, because we always practiced till the time we die. We always practice. So this experimentation is connected to that practice. Now, why it is important? Because there is a thin line between clinical practice and clinical trial. I'll give you one simple example. If a patient is coming to me, say, sir, I have migraine, and give me all the symptoms of belladonna. Let's say, for example, so I chose belladonna. I give belladonna because it was written in the belladonna about the symptoms. The patient gave me symptoms. I matched the symptom, a simple homeopathy, and I give. So in this scenario, it was my faith. It was my baseline knowledge. It was my faith. It was reference from the literature that belladonna works in such kind of headaches. But if I flip the question otherwise, does belladonna affect patients of migraine? So I converted my faith into a question. That becomes the clinical trial, the clinical research. Because I come from a research background, so uh, my purpose is to simplify things. So if you're giving by faith, it is practice. If you're giving by question, asking question, or a suspicion, that is trial. So in trial, you have all the ethical approvals. You need to, comply with the protocols, this and that. So, but the thin line is that it is faith versus suspicion. Now, this experimentation gives us experience. Until unless we experiment, we will not succeed. You know, we hear many legendary homeopaths or many speakers. I still remember when I was doing my BHMS. So maybe around 2005, I heard a very, very legendary homeopath, and he said that he cured one patient of infertility with Drustox 1M. So will my patient will also be affected by the Rustox 1F of infertility? No. Till the time I experiment on my own in my patients, I will not succeed. He told his experience. I need to have my own experimentation. Okay, I'll take a reference that Rustox 1M in such cases is important, or tuberculinum or bacillinum or any XYZ remedies or the conditions. But I will come home, I will come at my clinic, and I will experiment. Okay, fine. Let me give bacillinum and see whether it is the patients of fungus respond to this remedy or not. And let me tell you, it is a tricky situation. It works for them. It is not working for me because my experimentation setup is altogether different. My mindset is altogether different. My baseline knowledge, my application part is altogether different. So I heard that experimentation of theirs. I heard about the experience of theirs. I came home, but it didn't work for me. So this experimentation is basically we deduce from literature. Okay, fine. This remedy is, in the literature it is given good for PCOD, let me try this. And what I add, I just, add some dosage patterns, I change some frequency of dosage, I change some potencies, I start experimenting. Now, this is what we do when we pass out from our courses. The moment we sit in our clinic, the day one, and let me tell you, if even if you I have attended hundreds of seminars during my studentship, or acquired hundreds of participation certificate, the first patient will teach me everything, because that is my own experimentation in my own setup. So this experimentation is from the literature and from others' experience. Like I told you the example that a doctor experimented or presented a paper on such, and I will, okay, fine. I'll today I'll go, tomorrow I'll go my clinic and I will use these remedies because they experimented and they succeeded, and I will also experiment. So this experimentation is the second strongest pillar, and it should be there because it is the first hand information we get from the experiments. Nobody can help, hold my hand, okay fine, sort of do this homeopathy, do that homeopathy. No, at the end of the day I have to be an independent practitioner to practice. Even if I'm connected to a school or a thought or a group, at the end of the day I have to come back at my clinic and use those tips, those knowledges, those experimentations in my own unique way. Third comes experience. Now these are all, we have been flowing in a very very smooth way. We acquired a knowledge, we did our course, we did our experimentation for a few years, because people say that you have to spend 3 years at least in your clinic so that your clinic runs. This is what we were told. At least sit for 3 years, don't give up before 3 years, because first year would be beginner's luck. Patient will come to you, you will give something, they will be okay. Second year it would be a challenge, because whether those patient reverted back to you, whether they sent more patient to you, whether their families started coming to you. And the third year you started to learning, okay fine, this is my line of practice. So this experimentation, or this patience of 3 years or 5 years down the line, it is important. Now comes the experience. It comes hand in hand. Beginner's luck. I gave remedy, people started clapping. Okay, fine, very good, very good, very good. The moment I rose to fame, some complex diseases or patients started coming to me. Then I was in trouble, because I did not have experience of handling cancer in such a young age. Okay, fine. This happens with many of the clinicians. I'm just telling in a broader way that this experience is very tricky situation. So this experience comes from our own experimentations, and that is the best, that teaches you the best, because failure and success goes hand in hand. We learn from the failures also. Okay fine. And let me tell you one more real life example. We were sitting in our OPDs, I'm talking way back 2004 and 5, and we were told, do not give graphitis because it causes aggravation. One of our teacher, one of our HOD, she said that, oh, don't give graphitis because it causes aggravation. And we were afraid, because as a student, like final year student, we were in final year. Majority of us, we did not dare to give graphitis for those 2 years, the internship period and the fourth year, because no, 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 no. Ma'am has said that whenever you give graphitis, there is bound to be an aggravation. It was not our own experience. Then one fine day, you know what we did? We give graphitis to the patient. Nothing happened. We give sulfur to the patient. Nothing happened. People say sulfur, don't repeat sulfur, don't repeat sulfur. My experience is in low potency, sulfur can be repeated. Yes. In high potency, don't repeat it. Okay. In high potency, it is not dated. In low potency, if I'm using 6 or 30, I can vouch it works for me. It works for my patient, because I have now learned the art when to repeat it. You cannot blindly repeat in each and every patient. Okay, fine. You're coming with the skin eruption, itching, sulfur. You're coming with the urticaria, sulfur. You're coming with the this and that, sulfur. You're coming with the dermatitis, sulfur. You're coming with this, sulfur. No. Now I know the kind of patients They are going to report how they narrate their symptom, at what stage they need. So this, my own experience taught me many things. And then the others' experience also. The bitter experiences, our mentors, our teachers, they tell us, okay, Saurav, don't do this. Don't repeat remedies like this. Don't give remedies like this. Give LM potency. So what I did, to be on safer side in certain situation, I always refer, I always discuss the patient or the cases with my seniors, because I want to learn from their experience. Okay, fine, sir. I have a patient of acanthosis nigricans. It's a simple condition, but it is very hard to treat. Xanthelasma palpebrum. It is very hard to treat. Gallstone. I'm sorry, I have never, had any success in gallstone patients because it is not there. As per my experience, it is not there. So I admit that. So the others' experience is also important. Now, coming to the fourth and the most important pillar, because we have right now beautifully, we are going from the baseline knowledge to the experience or experimentation, and then the experience. Now comes the intuition. Now, intuition is very tricky. People spend their lifespan in having that intuition. Okay, fine, sort of, I think my gut feeling says in this case argentum is a preferred choice than arsenic album. I have read arsenic album, I have read argentum nitricum, and this happened few days back. There was a case, and I prescribed Cinna. You know why? Because that clinging feeling was there. The patient was clinging to the symptoms and the situation. And that clinging is basically in chronic phases of SINA can be a mental symptom also. It is not always that we give SINA for the worm infestation. But that when that clinging came, I had that intuition, no, no, this is a clinging. This is not suppression. This is not grief. This is not anxiety. This is not this and that. This is something which patient is clinging to. Okay, every few like statements, he take reference of that symptom. Okay, fine, doctor, that happened. Since that, I'm not fine. So we have in our materia medica, not well since. This is one. But if the patient keeps on clinging, so that gave me, hint about a remedy and worked. So intuition. Now, why intuition is important? Because it is beyond our thinking. It is something, okay, fine. Oh, this will happen. No, 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 no. Intuition is not that. It is something beyond. It is automatic. It just comes. It comes after much of experience, I would say. 20 year down the line, 30 year down the line, 40 year down the line. When we visit a very old practitioner, he says, oh, don't give this remedy, because their intuition says, their gut feeling says that it is automatic. They just say and it works. It is non-discretionary. Here lies the importance of philosophy in homeopathy. It is non-discretionary. If we keep on discreting things, like we had one dot few minutes back about the favorite remedies. Favorite remedy is a very common and very allowed concept. What Hahnemann said in Organon, we fail to understand a bit. He said, don't make favorite remedies. Favorite remedies for the disease names. But we all know that in our clinic, we use not more than 50 to 60 remedies at a stretch. You start writing the names, you use the remedy. And let me tell you how many remedies use. We have 300 remedies. We use occasionally, but in running, over a month, over 2 months, 3 months, you will see those 50 remedy you're, uh, putting in your list, that I have to make the order, I have to give the order, because those are the frequently indicated remedies. So should I call them the favorite remedies? Yes, in a sense, say, because for a group of diseases, because there are certain seasonal diseases or environmental diseases, like for example, cough and cold, this is a season change time. winters in Delhi. So patients have, cough and cold or season change, they come. So I have a, group of remedies from, ranging from aconite to brainia to dulcamara to gelsemium to eupatorium puff to kalibai, hepersulf, spigelia, sanguinaria, like this. So, I have a, battery or a group of remedies which I use frequently. But what happens if for every sinusitis patient, if I start giving sanguinaria can? That is the problem. No, sanguinaria can is not the only remedy. Sanguinaria nitricum can be a good remedy. Kali can be a good remedy. Phosphorus can be a good remedy. So I need to keep my mind open and receptive. So this intuition is non-discretionary because there is a difference between intuition and prediction. Here we fail. We predict. Okay, fine. Take this remedy, you'll be fine in 4 days, 5 days. Natural history is there. The patient is okay. But can we predict in each and every patient? If this is a common practice, a youngster, has the habit of predicting because the patient usually asks, so how much time would I be okay? For how many months do I need to take the treatment? Okay, fine, take the treatment because it will take 3 months. Okay, it will take 6 months. Okay, it will take 2 years. Okay, who are we to predict? Is there any mathematical equation or a biological mathematical equation we are very well versed with? No, I'm sorry, no. We cannot predict even a simple cough and cold sometime, makes a nuisance for us. It's a trouble for us. You give every remedy, the patient is not responding. Every remedy, you give one remedy, two remedy, three remedy, four remedy, nothing works because it just happens. So that prediction, I think we need to stop predicting things. It's a flow. It's a flow. When you practice homeopathy, you need to have that flow. And I think because there are many senior physicians sitting here, they know that when the patient comes, they know that flow. Okay, fine, take this remedy, keep on taking this until unless I stop or I taper it off. Because I cannot say, okay, fine, in 3 months your gallstone would be dissolved, and after fourth month the patient would be standing in front of you, sir, you said 3 months, but now it is 4 months, nothing happened. So intuition versus prediction is one which I think is we need to practice. We need to accept that. Moving further, don't be blinded by predictions because they're not intuitions, they're just predictions. Because sometimes in anxiety also we predict, okay, take this. No, if you have the gut feeling, follow it. No problem, follow it, because this is how you will sharpen your artistic skills in homeopathy. Now, everything is fine. The four pillars are okay. But where is the problem? Where's the problem? We have the good baseline knowledge. We had the best of the teachers. Whenever I talk to my teachers, they had their best of the teachers. Even I say I have the best of the teachers. They taught me. I have books with me. This and that. I started practicing. I'm into research. This. I started experimenting. My experience is there. Now it's been so many years in homeopathy. So where is the problem? The problem lies in the wrong order. Why? Because we want to get quick success. Every youngster, after 4 year or 5 year down the line or practice, they're not less than Hanneman. Everybody wants quick success. Okay, fine. I have done this work. I have done so much work. I am so successful. What about failures? What about failure? Did you have any failure? Okay, fine. I had failure, but I don't want to discuss. Why not? Let me tell you my own experience. I was the one I was the one because I have ego. I was the one. I started a journal of case studies in homeopathy. Long back. I mean, I'm talking decade back because I'm into homeopathy since 24 years now, being a student of homeopathy. So I started the journal of case studies in homeopathy. I ran that journal for 3 years. I used to ask everyone to submit their cases because it was the first open access journal in homeopathy dedicated to case series only, cases only, and it failed. Despite having so many homeopaths, so many cases on social media, but people were not willing to submit according to the guidelines. So I struggled with that for 3 years. I developed a website, jchome.org. I put that online, contacted people, ran for 3 years, but ultimately I had to shut it down. And that was a failure, but that was a failure because that was a failure which gave me more motivation. So failures part of homeopathy. I don't agree that everyone is so successful and nobody had any failure. So we want to have that quick success without following the order. We have the baseline knowledge. We start using others' experiences without experimentation part. We started using, okay, fine. My sir has used this. I'll use that. My mentor has used this. I'll use that. Without asking question, just I'm so sorry for this like short break in between. So everyone wants to have use that experience of others to rise without that experimentation. But I believe, because if we do that, we fail at certain times or we get huge challenges. I've seen people claiming very tall claims. Okay, fine, we will cure cancer and we will cure those chronic cases. We have this. Why not? Why not to publish those things? Why not to present the evidence based data that is still lacking in homeopathy, right? So I think that order should be there if we want to have a success or a stability in homeopathy as a practitioner. Because if we are stable, if we have those strong foundation, we'll go a long way. Otherwise, I've seen people starting with the boom, now they are nothing. They're nothing. 4 year, 5 year down the line, they just fade off. So with this, I think we are open to discussions because it's an important topic. And I'm Dr. Saurabh because Dr. Dinesh has given a very wonderful introduction of mine. But I'll just take 1 minute to show this on slide. This is I Support Homeopathy. I started this campaign to promote and support homeopathy because this is one such hashtag which connects us all, whether are a practitioner, whether our patients or our stakeholders or lovers of homeopathy. This I Support Homeopathy, it's a complete global campaign to support homeopathy. So I would request all to support I Support Homeopathy, use this hashtag, and now we are open to discussion. Thank you.
Thank you, Dr. SAURAV Arora, sir. It's really a beautiful session indeed. And we really enjoyed every moment of your presentation. And you really show the beauty of the science of homeopathy. And really the different pillars in that according to you there are 4 pillars, and the same way we used to say that the science of homeopathy stand on 4 pillars. The first is the doctrines of homeopathy, the second is the laws of homeopathy, and
Yes,
the
sir.
third is the knowledge of homeopathy, the patient, and the fourth is the pathology of homeopathy, and all
Yes.
this comprises the science of homeopathy. And we used to say that the homeopathy has the other part, the application of this knowledge for the purpose of cure can be called as the art of homeopathy. And you connected this thing in a different way, and how when one started practice and how it can be applied, and what is the how one can grow by acquiring knowledge from different senior doctors. And not only that, your ending part itself, you show the how one need to promote homeopathy in a different way. And you are a person doing these things for the last so many years. to promote your research work. Everything were excellent. And in one case, you told that you just give Sina because of the particular symptom that you noted in that case. And so also, I have an experience in giving Sina in a chronic case where the only symptom I note there was the patient was having severe appetite, and when whatever things she take, but still she is not getting improved. And in those conditions, she craves sweets and everything. But it's an acute condition itself, and the patient was admitted several times in the hospital, and they took the various X-ray, the various scans, and they couldn't find anything. But all in all, that the case was cured by a single dose of Zina. Anyway, congratulations once again, and it's a time for discussion. And Dr. Manoj is about to begin the session, and then we can go to Dr. Beatrice from Germany. Yes, Dr. Manoj.
Thank you, Dr. Ganesh. We must, and Dr. SAURAV ARORA, we must discuss a few points regarding your conclusions. I think the medicinal aggravation you said that was not there, not often happening, but I think otherwise. Because we know that how or why Hahnemann reached the 50 millisecond potency, what forced him to adopt the scale? Because of the aggravations. So how these aggravations are producing? When you apply a remedy, then again, when you give medicine with large attenuations, definitely there will be aggravations. Without such responses or reactions, homeopathy is not viable. So how can we say? Then again, you mentioned about the publications. This IFPH platform is the apt reply. This is the 1,600 days. The last this much days, we have plenty of these seminars. Now almost all are evidence-based. Then again, the Central Council of Homeopathy, we have arranged a couple of sessions from that. Hundreds of articles and publications are there. It is beyond our brain. We cannot assimilate or digest all these things. So publications is there. The research work is there. Everything is there. But what is lacking is the investment. If there is the proper investment, definitely we will be accepted. There's the lone limitation. Another limitation is the limitation of science, I think, not homeopathy. The physics and chemistry should develop to give a proper explanation of homeopathy. Anyway, your assumptions and conclusions are good because this is a natural science. It has its own flexibility. Okay, thank you.
Thank you, sir. I would like to add one more thing. In 2011, what happened? I was I worked in council for like 8 years. In CCRH, I worked for 8 years. I felt the need that research is one thing which is, that there's no translational research. There are plenty of researches. So what I did, I run a research website that is researchinhomeopathy.org. That is initiative to promote research in homeopathy. And few weeks back, I used to have an e-journal. Now I publish the translational research. Why? Because research is there, but the apt understanding is not there. Like for a clinician, they have published very good researches, but what takeaway message did I get from that research? That is lacking. What you said, investment, that understanding, that link, that connect between the dot is lacking. We have plenty of data. If you go to my website, I think there are 1,000 studies, 1,000 peer reviewed studies still in the database, and that database is yet to be updated. Like for a few months it is not updated. So I'm sure if I update right now, it would have, I would have 1,500 peer reviewed studies on my database. So that is there. So we need to come together, connect the dots. There are problems, from understanding point of view, from a physical chemical point of view, from clinical point of view. Homeopathy is being challenged. So this platform, I think it's good because it is inviting people from different thoughts coming together, discussing things. I think it is for the betterment. Thank you.
Yes, now I invite Dr. Beatrice from Germany.
Okay, yes. So, Dr. Aurora, many greetings from Germany. I really enjoyed your presentation. I send you a big embrace. And I feel it's so important. Your 4 pillars also. It's so important to ask ourselves, how are we working? And for instance, that you point out that the intuition is an important part and the artistic part, that is true. But we have to be conscious about that. That's so important. And I did like also very much, as you said, the prediction to the patient. We should not do, no. Like I with allergic conditions, neurodermatitis, with a lot of problems of the skin, not sleeping. And the parents are also asking me, doctor, how long? And I say, normally, I say like this, okay, I see your child. I feel it can be better. But let's take 3 months to see. And normally, the homeopathic remedies are working quickly. You don't have to wait 3 months to see an effect, but to find the line of treatment, we need that time. So they settle down. And what I also would like to point out, that Dr. Hahnemann, he was the first one. And he could not ask any teacher. Yes? So I often ask myself, in that time, it was so special that he was writing everything, every word of his patient, he was writing down in the patient protocols. And nobody did do that in that time. But why did he do that? Because he knew he would learn from his patients. The only source he could learn and experiment his ideas and his observation would be the patients. So I like that very much, that you also said we learn from our patients. And in the beginning, normally we have luck when we start. That's also my experience. The first year we have luck. So our teachers told us, please, homeopathy is very complex and it's very beautiful. But in the first 10 years, you are beginners. That also helped me. Thank you.
Thank you, ma'am. Thank you so much. Like you said, the Hahnemann did not have any teacher, but he started struggling with the baseline knowledge. He read every available medical philosopher or a practitioner at that time. This is how he developed that baseline knowledge. He started experimenting. So all these 4 pillars are basically homeopathy's pillar. Hahnemann used those pillars. Hahnemann had the data from the patient. He was the first one to maintain data in homeopathy, the first clinical trial.
Mhm.
Right now, we say about the clinical trials of stage 1, 2, 3, 4. He was the one who identified a molecule, and now we see the molecule. He identified, like Syncona. Yes, he identified. He went on to the, finding the specificity, sensitivity, the drug reaction, stage 2. He used those in patient stage 3, and he presented to the profession stage 4. So Hahnemann is like, we cannot like even go somewhere near to Hahnemann, but yes, I think this platform gives us this kind of discussion that we are open to. So thank you so much.
Yes, and now I invite Dr. Indrani Bhavatkar to ask
Thank you,
your
sir.
question.
Yeah, thank you, sir, for allowing me. Sir, I'm Dr. Bavdekar from Pune, Maharashtra. Very nice points you have highlighted. The point which I liked was that of diagnosis, because many homeopaths basically they don't give importance to diagnosis from homeopathic point of view. I have seen that they find the big repertories, books, and they try to find the remedies for that diagnosis. For example, all clinical conditions, and they try to find remedies for it, and there's always a failure for that. So this point was very nice. And actually, I think we should basically ask everyone, like all the students and all, that how did you approach a case from homeopathic point of view as well as a diagnosis point of view? So these things are very nice. So I appreciate for that. My another query was that how is the situation of homeopathy in London at present? Because I am facing patients from many countries. I work in CRF main. So some parts it is accepted, some parts it is very difficult. So what will be your view for that?
Sir, I'll tell you very briefly because I think time is running out. In UK, there's no problem if you practice homeopathy. It is readily available. The medicines are there. A couple of pharmacies, Nelson's is there, Helios is there. So it is not included in the NHS. But as a if you want to practice privately, there is no problem. So the medicines are readily available. The patients are very open. The things are very like. From a not from a government point of view, I won't suggest, but from a practice, from a private point of view, there's no problem for homeopathy in UK as far as I know, because uh, I am one of the founder director of the London College of Homeopathy. So we run courses like for the past 7 years in UK now, and for the most of the time I'm in UK only, so there's no problem.
Okay, thank you very much, sir. And it is up to our Vice President, Dr. Shaji Kudir, to say a few words.
Thank you, Dr. Danesh, and it is nice to have you, Dr. Saurav, in our forum. Welcome, and we expect more from you to this forum. And I am observing and watching your activities among homeopathy. Thank you for doing wonderful job. And I wish to share few points with you for your awareness and awareness of others also. You said the publications are important, but the problem with the current level of publications is that the research methodology we adopt in our publications. So, what is the research methodology suitable to a holistic system of medicine needed to be identified, and we should stick and promote that one to bring out the potentials of a holistic system of medicine than simply following the material science-based methodology that is suitable only to a commercial allopathic system of promotion than a holistic system. That is one point. Then homeopathic medicine is not only patient specific; it is also doctor specific. That diversity is there. That we need to understand that big diversity as a holistic system of medicine, and the approach to treat chronic diseases and acute diseases should be different. So Hahnemann took almost little more than 40 years in his life to develop homeopathy, but we should not stop there. Within that 40 years, he modified organon to almost 6 editions. So after that, no modifications happened. So it is our duty to further homeopathy to make it as the number one system of the number one system in the world. So a lot of furtherance and modification needed, that we are responsible, and we need to contribute that we all are responsible for that. So there is need for scientific furtherance from material science to holistic science, especially in medical research. We need to focus in that area also. So these are some of the important points I wish to bring to your attention also. As I understand, you are very wonderfully doing very beautiful, great jobs for homeopathy, and we are all contributing in our capacity, whatever way. And congratulations, and we expect to collaborate, and we appreciate your presence and more presentations in our forum. Thank you.
Thank you, sir. Thank you so much for the wonderful feedbacks.
Yes. Yes, I invite Dr. Sunil to say what are thanks to the session.
Welcome, sir, and good evening, Dr. SAURAV ARORA, Dr. Danesh, Dr. Manoj, and Shaji Kudir, all the participants here. It is a very excellent presentation, sir. Because you are, by introducing the 4 pillars, you were trying to point out that why homeopaths are failing in the practice. So if you are following all these 4 pillars, I'm sure we will, all the homeopaths can take a very good approach to the system, and we can do justice to the system. Anyway, thank you, sir, for coming and presenting an excellent presentation. Thank you, sir. Thank you. Thank you all the participants.
Thank you, sir. Thank you all.
Thank you. Thank you, Dr. Sunil. Thank you, Dr. SAURAV ARORA, and those who participate in the session. Tomorrow, we will have a session from Dr. Huang Liang from Brazil, and Dr. will be talking about prevention of diseases in pregnancy using homeopathy and TCM. So, TCM. With that, we come to the end of the day 1607.